Does this sound like you? You're in your 30s, you're excited to start a family, but 6 months off birth control and nothing. You haven't been able to get pregnant. Or maybe you've been on this journey for several years and you've been facing heartbreaking delays. Maybe you've tried IVF, that hasn't worked, or you've been told that you have poor egg quality or low ovarian reserve, or you've got a condition like PCOS or endometriosis that's standing in your way of having a baby. If any of this resonates with you, you're in the right place. Hi, I'm Dr. Gina Teranoni, and today I'm sharing the exact steps that I use to help over 2,000 women and couples to overcome infertility, improve egg quality, and finally get pregnant and have a healthy baby. And usually when I work with people, it's within 4 to 6 months that they're able to get pregnant. This is not about quick fixes, but addressing the root causes of infertility with a proven natural system that's based on my 25 years of experience. Before we dive in, please make sure and subscribe to the channel for weekly tips on boosting fertility, balancing hormones, and preconception care. And if you're ready to get started today with a simple mini course, comment 7 days below, and I will send you a link to get access to my Fertility Fast-Track Course. It's a guided 7-day audio program, so it's like podcast, and it costs less than a cup of coffee or a cup of tea a day. The link is in the description as well. Now, let's quickly go over what may be standing in your way of getting pregnant. The journey to getting pregnant is not always straightforward. In fact, 1 in 8 couples face infertility issues. So for women, I have the top 10 reasons why that may be happening and what's preventing conception. Number 1 is ovulatory disorders. So conditions like PCOS or premature ovarian insufficiency that can disrupt ovulation, which is essential for conception. Without ovulation, there's no egg to fertilize. Number 2 is age-related decline. Let's be honest, age does matter. After 35, egg quality and quantity naturally decline, which can make conception trickier. But don't worry, because I'm going to get to that in this video. Number 3 is endometriosis. This condition causes uterine-like tissue to grow outside of the uterus, leading to scarring and inflammation that can block the egg and sperm from connecting. Number 4 is blocked fallopian tubes. Issues like pelvic inflammatory disease or past surgeries can cause blockages, preventing the egg from traveling to the uterus. Number 5 is uterine abnormalities like fibroids or polyps or structural issues with your uterus. This can interfere with implantation or increase the risk of miscarriage. Number 6 is hormonal imbalances. Hormones like thyroid or prolactin or cortisol, they all play a huge role in fertility. And if they're out of balance, ovulation and implantation can be disrupted. Number 7 is lifestyle factors. This is something that you have a lot of control over, and I can help you go through and see what might be a problem or see how to switch things up a little bit in the more positive direction. So we're talking about no smoking, cigarettes or marijuana, alcohol, stress, extreme stress, even light stress can create some blockages in your system. Poor diet, not getting enough nutrients, or even obesity can have a significant impact on your fertility health and overall reproductive health. Number 8 is unexplained infertility. Sometimes tests don't reveal the root cause, leaving couples feeling lost, but there's almost always a reason that just needs to be uncovered. So really what unexplained infertility is saying that they just couldn't find the reason, but it doesn't mean that a holistic doctor like myself can't find the root cause. Number 9 is autoimmune disorders. Conditions like lupus or celiac disease can lead to the body attacking its own reproductive system. This will absolutely impact fertility health. And number 10 is poor egg quality or diminished ovarian reserve. This means fewer viable eggs, often due to aging or medical conditions. But improving egg quality is something we are going to dive into deeply today in this video. Hearing these causes, I understand this can feel overwhelming. Oh my gosh, I just gave you 10 reasons what could be causing delayed fertility or infertility. But here's the good news. Many of these challenges can be addressed naturally by focusing on your overall reproductive health. And that's exactly what we're going to do today. This is what I'm going to share with you in this video. I've developed a proven system to help you tackle these obstacles and prepare your body for pregnancy. I call it the 4 pillars of fertility, or as I like to call them, the 4 S's, and you'll see why. These 4 S's, they've transformed lives of 2,000 plus women and couples, and I've helped them conceive and have healthy babies. And in the next part of the video, I'm going to guide you through each of these steps and explain how they work and how you can apply them to your life right now.